Dr. Paul, I got a question about what do I tell my doctor before I start any mental health medication? Well, I mean, again, you got to make sure you're going to someone who really understands the subject, who knows how to treat it well. Sometimes a family doctor will, if they're good at it. Sometimes they'll only, if it's a simple problem, if it's more complex, you'll probably have better luck with a psychiatrist. Again, I function like a psychiatrist because I'm a family doctor, for 33 years, but I've been doing this full time for about 25 years. So seeing someone who really understands is really important. But as far as what to tell your doctor, well, the doctor should know what kind of information to get from you. So what's important is a lot of things. And when all my patients, new patients, I have them fill out a new patient form where I ask it's like a few pages long. I ask a lot of questions, and I can read through that, and like within 5 minutes, I can look through that and get a lot of information really quickly, which saves me time, and I'm able to get to more information based on just that baseline information can really be helpful. But we need to know everything. I need to know your symptoms, how long it's been going on, when did you feel normal, and when did you feel your best? When did that change in your life? So I need to know that. I need to know what's changed, what symptoms you've had. Have you had anxiety? Have you had depression? Have you had body symptoms? Have you had insomnia? How's your energy? So I need to know every symptom. And a lot of people don't realize that some of the symptoms are physical. And a lot of my first books are about the subject, about how emotion affects the body. So if you have like pain that you can't figure out, neck, back, shoulders, number one is these muscles right here. These are bothering you, your stomach's hurting, your chest is tight, so if you have physical pain that's not explainable, that could be stress related, and that's treatable. So you want to tell them that. Everything, your childhood, when this started. You want to, if it's a woman, I want to know about hormonal changes, how that's affected mood. That can also play a role with men. Family history, genetics is very important. So I want to know about family. I want to know about the person's parents, their grandparents, their siblings. So if I see any patterns in families, that's very important because genetics is a key component of this stuff. Genetics and hormonal changes, and then the trauma, stressors are the most common reasons for these imbalances in the nervous system, which can be fixable with medications. But that's why it's a matter of really going to a doctor who's interested in all this information. And, in my books, I talk about, this stuff. So, if you read any of my books, you'd be able to, have like a list of things ready for your doctor to go over. Or if you go on my website and just download my new patient form, even if you're not going to see me, you can basically fill that out and give it to your doctor. But fill it out as completely as possible to get all the details in there, and then hand it in to the guy and then say, or hit him or her, and then say, okay, well, here's what's going on with me. And hopefully they'll figure it out. And not to stick with a doctor that you're not getting results with. If you're not getting results, and the doctor doesn't really know exactly what to do and confused or whatever, you just need to move on. You need to find a doctor that really knows how to do this. So because it's important. I mean, we're talking about when it comes to mental health, it affects your whole life. It affects everything, and living with anxiety, living with constant fear, living with depression, being constantly miserable, it's no way to live. And so you want to talk to your doctor about getting it treated. Maybe therapy can help, maybe, but not to discount the role of medications and realizing there's a medical condition going on here that's very treatable. And you can do both. You can do medications and therapy if you want. And so, but not to discount it because it's important, and unfortunately, too many people just discount it because they just don't believe in it. They don't believe in something they don't understand. They just don't believe it because what they've heard, what they've read, and they've gotten bad information. So anyway, so hopefully that answers your questions about what to do. Just give them everything. I want to, again, you want to know when things started, how things have worsened, and when things might have gotten better. Just the whole, everything about your life. And you can even write down a chart about what your age, and you can even chart it out even if you want, as far as, how things have progressed in your life. And the more information we get as doctors, the better decisions we can make when it comes to treatment. So hopefully that helps you.